Good afternoon and welcome to Total Joint Class, everybody. My name is Kathy. I am known as the Ortho Navigator. I work here at Lourdes Hospital, Mercy Health Lourdes Hospital on 5th floor, which is where each one of you will wind up after surgery. Be it a hip or a knee, everybody comes to 5th floor, and that's where you will stay with us until your departure home. I'd like to introduce to you Miss LaDonna. LaDonna is an awesome physical therapy assistant that works for Mercy Health Lourdes Home Care. And we will talk about home care versus outpatient therapy. So basically, everybody that is a hip or a knee has to have some form of therapy when they leave the hospital. So I'm going to scoot over. Yeah. So hips. If you are a Dr. DeWeese hip, a Dr. Patel hip, you will be given the option for home care. That is going to be your therapy. If you are a Dr. Patel knee and or a Dr. Kern knee, you will be offered either home care or outpatient. Dr. Patel always does the home care period, but Dr. Kern likes to do either or. So it'll be a discussion between you and him as to where you will go for therapy. Dr. Beck and Dr. DeWeese all do outpatient therapy for their knees. And Dr. Beck, if he does a hip, he will also, believe it or not, do outpatient therapy. So that way everybody knows where they stand for home care versus outpatient therapy. Basically today we're going to go over things that's going to get your discharge going. And so I need you to be thinking outside the box of who it is that you would like to have stay with you for the first week, if at all possible. We like our patients to be able to have family, friends, somebody to be with them to make sure they're taking their medication correctly, make sure you're eating decent, and things like that. So think outside the box. It does not have to be a spouse. It can be anybody. It doesn't have to be somebody stout. It just needs to be somebody that can help you maybe answer phone calls and get you water, things like that. So think about it ahead of time because we really like somebody to be with you that first week. Now, some of you don't have anybody to be with you the first week. So if that is you and you know that ahead of time, you might be needing a skilled nursing facility for your rehab. Please talk to your surgeon beforehand so that they are aware. It has become more difficult to get people into a skilled nursing facility now. So just want to make sure you know that we will do our best to try to make that happen for you if that's what you need. But if the surgeon knows ahead of time, they can also assist you in that and be doing everything possible in their control to get you in. If you would like, you can even talk to some of the therapy places around. Go ahead and maybe go tour a facility. I don't know that all of them are open right now due to COVID, but maybe you can call ahead or talk to them. Maybe they have something that you can look online just so you can kind of be familiar with what the facility looks like before you go. Okay. Now we're going to talk about some food, and we're going to discuss iron-rich food first. Okay. The key to eating good food before surgery is to build the blood up, get you ready for surgery. There will be a little bit of blood loss for every procedure. It doesn't matter if you're a hip or a knee, there is some blood loss, so we want to build the blood up ahead of time. Iron-rich foods are things like the dark greens, the dried fruits and grains, the red meat, poultry, and eggs. Things like that are wonderful, so be eating those before surgery. We also want you to take in some things like the vitamin C foods, so the citrusy foods like lemons, limes, oranges, bell peppers, tomatoes, and sweet potatoes. And then if you look at your bulletin, you'll notice that broccoli made both lists. So pick out some good items and really start eating. Now we're going to talk about blood sugar. I've told you things to eat before surgery. We're also going to want you to eat those things after. Now I'm going to be hateful and tell you the things not to eat. Avoid the concentrated sweets. Things like cookies, cakes, pies, all those wonderful things we love to indulge in. Blood sugars are very important to keep them low before surgery. We don't want blood sugars rising above a 200 mark. So if you are a known diabetic, be monitoring your sugars ahead of surgery. Make sure you're trying to keep them below the 200 mark. And then after surgery, we're going to help you monitor while you're here in the hospital. We will do your blood sugars 4 times a day. So it'd be before each meal and at bedtime. And we may have to give you some insulin to bring the sugar down if you're too high. Don't panic if you don't use insulin on a normal daily basis. You won't go home with it. It's just to bring the sugars down initially after surgery. As far as the rest of you go, you're not off the hook. We are still going to check your sugars as well. We're going to be checking your sugar through the blood lab draws done in the wee hours of the morning. So lab will come about 4 o'clock to everybody's room in the morning to gather some blood vials, and we will be checking your sugar then. So just know you're not off the hook, and be cautious with the sugary products. Anybody smoke? Stop. Today's the day. We don't want you to be a smoker and come in here to have a procedure. Most of the surgeons will pretty much refuse to even do surgery on you if you smoke. Smoking is horrible for healing, and it absolutely is a major risk for infection. So there's no time like today to give it up. If you don't smoke, but you have a family member coming to see you here at the hospital that does, ask them to leave their products either in their car or at home, because we are a smoke-free campus, and we just would like to keep it that way. So that's all I'm going to preach on that. All right, I'm going to turn it over to Miss LaDonna.
Hello, everyone. We're going to talk about some exercises that you need to start doing today. And it doesn't matter if you're going to have surgery in a couple of days or if you're having surgery in 6 weeks. Every rep counts. So we're going to talk about the first thing on the list, which is ankle pumps. I'm going to turn the chair this way. That way you guys will be able to see my feet for sure. And you're just going to pump your ankles. Pump your ankles. So the next one is for the total knee replacements. This is a pillow that you will see me generally the day after surgery. If you're a total knee replacement, I'll come by and bring you one of these. And hips, don't be upset that you're not getting one. This is a working gift, unfortunately. So this is to help the total knee replacements get their knee extension back. So the docs like for you to rest and relax with your knee straight. So the only time this is in the bend of your knee is when you are doing a kicking exercise like this. The other thing you'll use it for is for your quad sets. You'll press your knee flat, just like that. Otherwise, it's just a really good arm rest. So the next one on your list is bottom squeezers or butt squeezers, and that is literally just clenching your bottom tight. The next one is your thighs, and you'll do this exercise before you have the pillow. And all these exercises are for the hip patients and the knee replacements. Your quads and your thighs are just pressing your knees flat, pressing your knees flat. So the next thing on the list is cardio. So with your cardio exercise, we're looking at getting your blood pumping, get your heart rate up. So we're talking maybe a little bit of light walking. If you can walk your driveway, do that. If your knee or your hip hurts too much to walk your driveway, then it is perfectly fine just to walk your hallway in your house. But let's say maybe walking your hallway in your house is too much for you and you really can't get your heart rate up because you just can't tolerate it. They make these nice little wonderful exercise bikes called restorators. They're about this big. They're usually around $30. I know for a fact that they have them on Amazon and they have them on Walmart.com. You don't have to get a fancy one. Just get the one that's just the little metal, and it is $30, and you can put it in the floor and you just put your feet in it and you just pedal. And they take up very, very little space. Most people will use them for a little while and then they'll just put them up against the wall and they're out of the way so you don't trip on it. Let's say your knee or your hip won't allow you to do that. This is not about range of motion in your knee or your hip. Now, this is about getting your heart rate up. So you can actually put it on a table and you can do it with your arms. So It's a very good investment if you're going to be having an orthopedic surgery, and I would recommend that everyone pick one up if they want to. So we're going to talk about some durable medical equipment and just some things that you're going to have and some things that you're going to pick and choose what will work for you. On the must-have list is the rolling walker that you see there on the screen. We do prefer the one that just has 2 wheels on it, but if you already have a walker and it's a rollator with 4 wheels with the seat, and that's what you're used to, that's just fine. You can use that. If you have a rolling walker already, you do not have to bring it to the hospital with you unless you need it to get in. They will use one with you that they already have here at the hospital, and Kathy will make sure that you get one before you leave if you don't have one. So we need to think about, it says next to there that your insurance will cover it. There's a caveat to that. If they haven't bought you one in the last 5 years, insurance will cover a rolling walker. Let's say you're the person that they bought you one in the last 5 years and you don't have one. You might want to think outside the box on how to get one so you don't have to pay out of pocket for a new one. Some of the churches have lending closets where they have the walkers, and then you might just borrow one from a friend or a family member. And I do urge everybody that if you get one of these and you get a new one, don't get rid of it. They fold up, they take up almost no space. When you're completely done with it, fold it up, put it behind your closets or behind your coats in the closet, and it takes up almost no space, and just keep it. You don't want to get rid of it. The other thing that is a must-have is a non-slip mat. Anyone can have a fall getting into their shower or bathtub. The last thing you need to do is have a fall after having a hip or a knee replacement. It's serious business. We do not want anybody thinking, number one, I'm afraid to take a shower or to get in there because I'm afraid I'll slip, or number two, to end up that they did get in there without a non-slip mat and they end up in the ER after having a joint replacement. It's not worth it. Get a non-slip mat, even if you just have that small lip to step over to get into a stand-up shower, we still need a non-slip mat in there. All right, some things that would be nice to have. Bedside commode. I've been doing home care for 15 years and physical therapy for a little over 18. And I would tell you that I wouldn't have a hip replacement or a knee replacement without a bedside commode. And it's same thing here. If your insurance has not paid for you one in the last 5 years, they will cover this. Even if you don't feel like you need the bedside commode, I want you to think on these terms. The most important seat in the house is usually the lowest seat in the house, which is the toilet. And that pot that's on the bottom of the bedside commode, it slides off. So you can set it right over your toilet, just like this chair I'm sitting in, and now you've got arms to push off of when you're getting up and down from the commode. So kind of think about the fact that it's probably a little bit difficult right now before surgery to get up and down from your toilet. If it is, it's going to be even more after you have surgery, and I would recommend that everybody get one of these. Same thing goes here. They'll only buy one every 5 years. Don't get rid of it. Put a trash, when you're completely done with it, put a trash bag over it and store it until somebody else in the family needs it. So the one person that would absolutely have to have a bedside commode is the person whose bathroom door is too narrow for the walker to go through. So here's some homework, what I want you to do. If you don't have a walker in your house already, what I want you to do is just put your hands like this and walk through your bathroom door. If you can fit going straight on, then it's not a must-have. If you cannot, I don't want anybody sidestepping through your bathroom door. It's a fall risk. We've already discussed. We don't want that to happen. So if you cannot get through straight on with your walker, you definitely must have a bedside commode. So the next thing on the list is the elevated commode seat. They're made of hard plastic and they have nice little handles on them. And what I've seen some people do is they would get those because they didn't feel like the bedside commode would fit in their very small bathroom. I will tell you that I've only seen, I can count it on less than one hand how many bathrooms that I've been in all of the years that a regular bedside commode would not fit over the toilet. It really usually had something to do with furniture that they had around, in the bathroom that made it not fit. But I've seen other people, they got the bedside commode for one bathroom. They didn't want to just be able to use that bathroom over their weeks of recovery, and they got the elevated commode seat for their second bathroom. And they're usually around the $30 mark as well. Grab bars, everybody needs at least one. The wonderful suction cup grab bars that you can get at any of the pharmacies, Walmart. You can get, of course, everything on Amazon. You can get one at Lourdes as well. They have suction cups on them. When I first seen them, when they first came out of on the market, I thought they were a recipe for disaster. And I actually had a little lady that said, honey, I'm having a hard time getting this to stay on. Can you help me with it? Her issue was she had tile on the bathroom wall, and she was getting the suction cup over the grout line, so she wasn't getting a good connection. So if you have tile in your bathroom, make sure that the suction cup goes right on the tile and doesn't get on the grout line. It'll make a really good connection, and they are really, really potent with being able to stay on. Once I got it on her wall, and any of them I've done since then, which are a lot, when I help patients out when I'm in the home, literally you could pull the tile off the wall and the suction cups wouldn't let go. So everybody needs to get one grab bar to get in your bathtub or shower. That way you've got at least one thing that is solid to hold on to. The last thing you want to be thinking is it's just not safe to get in. We all know that after being sick or having surgery, what makes you feel good? I've heard this saying over and over. It made me feel human again. Get in the shower and let that warm water run over you. So get a grab bar, get the non-slip mat. That way you can take a shower soon after you get home. So let's talk about a shower chair or bench. A shower chair has 4 legs and it sits right inside the bathtub or the shower. They're nice to have, especially if you have other health issues that are going to make you feel more weak or more fatigued easily. But I will tell you, after either one of these surgeries, that is one of the long-standing complaints is I'm just tired, and getting ready and getting cleaned up can make you even more tired. So if you have a shower chair, you can sit down to take your shower. You do have to step over the bathtub to get into that one. A shower bench takes up a little more room. There are 2 legs outside the bathtub, and then all you do is you sit down on it, and then you do your legs like this over and into the bathtub so you don't have to step in. They take up a little more room in the bathroom, not that much, and if you have other health issues, you might consider a back bench. Handheld shower. If you don't already have an overhead shower, you might consider the little handheld shower that goes into the nozzle down low, and that way you can shower off. Elastic shoelaces. Here's another thing that I would not have either one of these surgeries without having elastic shoelaces. Every one of you will inevitably have swelling. So you need to usually wear shoes that lace up, that'll give you enough room to get them in there. We're not going to want you wearing flip-flops and things like that, so that usually tends to put people in range for tennis shoes. So we recommend the elastic shoelaces because you lace your tennis shoe up that you're going to be wearing, or whatever shoe you might be wearing that's lace up, and you fit it just right to where it'll be snug, and all you have to do is slide your feet in, they expand out, and then once your foot's in, you don't have to bend over and tie your shoes. Hips, you don't have a lot of restrictions like hip replacements you used to have, but you will have some. So I was looking at the picture, it looks even clearer. So you will have some restrictions. The doc doesn't want you bending over, so having the elastic shoelaces, you'll get your shoes on quicker. Knee replacements, it just hurts to bend over. So having the elastic shoelaces, especially if you guys are the type of person that's a little bit independent and you're going to want to do things on your own, some of these things are going to put you being able to do these things quicker. So we're going to move on to the hip kit. The hip kit is called that because hip replacements you used to have a ton of restrictions. And it's kind of like Kleenexes and tissues. We call them a Kleenex because that's what we've always called them. So we still call it the hip kit, even though you guys thankfully do not have the restrictions that you used to have. But some of these things you may want. So the first thing on the list up there is a reacher. If you don't already have one, you might want to consider one. You can get them anywhere. And think about how many times on a normal day you drop your cell phone or your glasses or your remote control. Well, when you start taking narcotic pain medication, which we all will after these surgeries for a little while, you drop things more often, and you're not going to be able to then excessively forward for a little while if you're a hip, and again, if you're a knee, you're just not going to want to because it hurts. So having a reacher to be able to pick your remote control up if you dropped it on the ground is a good thing. The next thing is a long-handled sponge. If you've got shoulder issues and mobility issues, you might need the long-handled sponge, but not so much just for the hip or the knee. The next thing is a long-handled shoe spoon or shoe horn. They're only a couple of dollars, and if you absolutely have to have one of these because you have your elastic shoelaces on, and then you just do this and slide it in, and you don't have to bend over. Hips, again, you can't do a lot of forward bending, so you need that long-handled shoehorn, which literally cost $2 to get one of those. You don't have to get anything fancy, just get a plastic one. And the next thing is a socket. I say this every class. I hope the person that came up with this is a millionaire. That thing works. All you do is flip it over from the position that you see it in right now. You slide your sock over that white tube. You hold those black handles and just drop it in the floor. Then you slide your sock right on. It works wonderfully. Between having the elastic shoelaces, the shoehorn, and the socket, you'll be getting your socks and shoes on day one. And if you have a person that is going to be helping you out, that it would be difficult for them to help you get your shoes and socks on, you might buy those things for them, and so you don't have to ask for help as much. All right, so the next picture shows the fella sitting in his nest. I didn't name it that, my patients did, and they call it that because you got all your goodies that you're going to be needing. You got it all right there real close, and if you notice, he's in a recliner, and that's where a lot of people are going to be. So I'm going to skip down, and we're going to talk about the chair height. So one of the reasons our recliners are so wonderfully comfortable is because you sink into them. Well, if your recliner, especially if it's a rocker recliner, is hard to get out of right now, it's going to be even harder after you have the new hip and knee for a little while. So you might want to think outside the box about getting in and out of your seat and what's going to be the right chair for you. So if you sit down in your recliner, this is more homework for you, and your hips drop below your knees, it's going to be hard to get up out of there. So what you might need to do is, no, you don't have to buy a new chair, not saying that, but what you might need to do is make it a little higher. And it's usually fellas that I have seen do this. They'll get a nice sturdy pallet and they'll put it under there. It's not pretty, but it works, and it'll raise you up about this much, and it's easy to get up and down from your chair. What a lot other people do is they'll take a cushion out of another seat and put it in there, or the most common thing that I see is bed pillows, 1 or 2 bed pillows to keep you from sinking down in there. Makes it a lot easier to get up from the chair. So we're skipping forward to being home. We got to get you in the house. So if you're that person that has steps to get in your house, they're going to teach you how to do steps before you leave the hospital. No worries. You'll know the proper technique and you'll know how to do it. They're also going to give you a gate bell, so whoever goes home with you can hold on to you while you're going in the house. But if you're that person that has, say, 2 steps and no handrail, you may want to think about getting a grab bar that's on the outside that has to go in the stud. And this is something that a person who is handy, that knows what they're doing, needs to do. It's not as simple as doing the suction cups. So if you got 2 steps and you don't have a handrail, then you might want to do a grab bar. If you've got more steps than that, if you can get a handrail put in before you have surgery, that would be wonderful. Not all of us can do that. So if you have more than a couple of steps. You got to get in your house, and you're not going to have a handrail. I would prefer 2 people go home with you and hold on to the gate belt just for stability, getting in the house, just so you'll feel stable and you'll have somebody to hold on to on each side, and you definitely will use the gate belt getting in the house. But no worries, they'll show you how to do those steps. So the next thing is, we've already talked about he's sitting in his nest in that picture. So we have a tendency to get things kind of cluttered around our nest sometime. We might have magazines, we might have newspapers. We got to clear those things out. We've got to declutter. So you got to walk through your home and look at the paths that you use normally. And you've got to make sure that they're wide enough for your walker to get through. We talked about the bathroom door, but it's not the only thing. You've got to make sure your general paths down your hall. What I've seen doing home care all these years is we like to have these nice little console tables at the entrance of the hallway, and it makes it too narrow for the walker to go through. Or we've got these nice little console tables with the beautiful mirror at the end of the hallway, and it makes it too narrow to turn into a bedroom or a bathroom. So I want you to go through. I want you to look at your past, and if you need to move a piece of furniture, it's not forever. It's just for your safety after you have surgery while you're using an assistive device. The other thing is cords. If you have cords in any of your pathways, those should go and they should never come back. Even if you have to track it up over the doorway, much safer than having it along the floor. The other thing are rugs, and ladies, we're guilty. We like our rugs. The problem with the rugs is you got wheels on the front of the walker, you don't have them on the back, and what happens is the walker will go right over the rug with the wheels, and then right as you're coming through, that the back legs on the walker will pull that rug up, and then your foot catches and you can fall. So your stability is not as good after you have a new hip or a new knee at first. That's why you're walking with a walker. So your riding reactions are not going to be as good. We do not want a trip to the ER simply because we had a fall, because there was a rug in place that needed to be moved. So the night before surgery, I would like for you to roll all your rugs up, put them behind your couch, put them in the extra bedroom where nobody goes, and just get them out of the way just for a little while until you're done with walking with a walker and maybe even the cane. And now we're going to trade out.
Thank you, LaDonna. All right, so now we're going to talk about some safety. We've already mentioned that we want to have somebody home with you for the first week, if at all possible. And like I said, that's just to make sure you're eating good, getting plenty of hydration, and taking your medicine in a timely manner. One level living. Okay, as LaDonna touched on earlier, you will all be shown steps here at the hospital before you go home. So yes, you can do steps. We don't want you doing them all through the day, okay? So if you can have a bedroom, a bathroom, a living area where you can rest and recline and relax, get that leg up, and a kitchen where you can get food all on one level, we are happier for that for you. That's what we want for you. If, let's say that's impossible. Let's say you can have the kitchen and the living room on one level, maybe even a bathroom that you can use, but the bedroom's upstairs. That's fine. Worst case scenario, you take the stairs once a day. You go up, spend the night, sleep, and when you come down the next morning, stay down until you have to go back up for the night to sleep again. Clean house, that is twofold. LaDonna touched on the fact that we want to declutter. Get rid of all that excess stuff laying around that could be a trip hazard for you. And clean house in that you have a brand new wound and we want to keep it from infection. So please get everything tidied up ahead of time, and that way you're not sitting around, laying around for a couple of weeks looking at stuff driving you crazy, okay? Frequently used items. So if every day you've got something down here that you're getting out and you're using, or you've got something way up here that you're getting to use every day, bring it down to a countertop level. It just will make life easier for you. For my hips, your only real precaution is no real deep bend, so we don't want you bending over. Knees is just gonna it's gonna hurt you. Let's just be honest, it's gonna hurt you to try to bend over for real deep. So anything low, anything real high, we don't want you on step stools, so that's out of the question. So bring it down here. It'll need to be there for a week or two, and then it can all be put back. Easy food items. Okay. We mentioned earlier that we wanted you to start eating some really good foods that are full of vitamin C, full of iron, and to help build the blood. We want you to eat that same good food after surgery, but I don't want you up 30, 40 minutes preparing it. So I ask that you think outside the box. Maybe you talk to some family members, maybe some church family, people that you can rely on, and maybe somebody that will help start bringing you some food by periodically. If you're the cook in the family and you've got nobody that you could really rely on, maybe you want to prepare a few meals ahead, pop them in the freezer, and that way all you got to do is take them out, microwave them, you're good to go. And then I touched on this in some of the classes and LaDonna probably knows more about it than I do, but there are some good places local that do meal preps, and you can call them and possibly order, and they have delicious food that's real easy to just heat and eat, and it's good for you. Arrangements for pets. So let's say you have a fur baby, a dog or cat that lives in the home with you, and you're wondering, do I need to have them put somewhere else? No, they don't have to leave the home. Here's the thing to remember about your babies. When you come home, you've been gone. You've been at the hospital possibly one night, maybe even 2 nights, and they have missed you. They don't know where you've been. You come home, they are going to be so excited to see you. They might want to jump on you. And so we don't want them to jump and claw or scratch your new wound. And they may not know the first thing about a walker and get under your foot and trip you. So just really think about them. It's okay for them to be there, but maybe have them in a safe location until you can come in and get situated in the home comfortably, and then bring them into the environment to let them get used to you being back home. Temporary handicap sticker for the car. This is a 3-month sticker. It's like the little placard you get that will give you freedom to get back out into the community after your surgery and you start feeling better and you want to get back out. It'll give you that freedom, but it'll allow you the possibility to park up close so that you're not parking way out and trying to walk a long distance on this new joint. You have to have surgery first before you can get it, and the surgeon has to sign off on it. So if you would like one of those, speak with your surgeon and they will arrange to get you one. I have some copies here at the hospital, but they also have copies at their facility. So they can assign one for you and have it ready to give to you after your surgery's done. Let's talk over the counter medications, okay? I need every single patient coming in for a total knee and or a total hip to buy a teeny tiny bottle of extra strength Tylenol. I want it at your house, ready on standby. Tylenol, believe it or not, is actually really good for post-op surgery pain mixed with your other meds, and it is excellent for fever reduction. And sometimes some of the total joint replacements will run a low-grade fever after surgery. This is what you would go to for that. So extra strength Tylenol. Aspirin. Every one of the total hip knee patients, every one of you will be required to take some aspirin after surgery. Dr. Patel uses between 81 and 325 milligram. We never know which one he will pick for each individual patient until after surgery's been performed. So don't go buy it ahead of time. Don't try to figure it out. He will put you on Xarelto or Eliquis for 3 full weeks first. Then he'll convert you over to the aspirin. So you will have 3 weeks to get your bottle purchased between needing it. Dr. DeWeese is straight 81 milligram. He'll have you use it twice a day for a month. and he orders it, calls it into your pharmacy, all you have to do is swing by and pick it up. Dr. Kern always uses 325 milligram aspirin. He wants you to take that after 2 weeks of Xarelto. So you will be on Xarelto first, then you will convert over to the aspirin. So you will have 2 full weeks to pick up a bottle if you don't want to ahead of time. Dr. Beck is always 325 milligram of aspirin, and he gives you a prescription for it. So just know that that's what you will be on after surgery. Excuse me, now we're going to skip down to Colace, stool softener. Colace will not make you go to the bathroom, folks. It only makes the go softer. So while you're here at the hospital with us, you will be on a product like Colace, and we'll give it to you generally twice a day. But when you go home, there is not one doctor that orders that for you. So I ask that you go by, pick you up a bottle. It can be Colace or it can be generic stool softener. I don't care. Whatever you want to use, pick some up, have it at home, ready for use, because you will be asked to take that after you leave the hospital. Miralax, skip on down to Miralax. Now that's a goer. So Miralax is not the only goer. You can have things like milk of magnesia. For some people, it's coffee. Some people, it's prune juice. I really don't care what works for you. Whatever works for you, have a small purchase amount of it at home, ready, on standby. Because every 3rd day, I need you to have a bowel movement, period. Okay? And so if you've not managed to go on your own, you will take whatever you've got on standby and make yourself go. So just be prepared. I don't want you to get home and forget that part, because you're going to be in misery by day 3 if you have nothing on standby. Pre-admission testing. Okay. So all of you that come to the pre-admission testing, you're going to come and they are going to do an EKG on you. Every single one of you will have that done, and that is the stickers that they put all over you, and they're going to check your heart rhythm to make sure everything's good, okay? Labs. I call them the vampires because they are going to drag out of you 3 vials of blood, okay? It's coming out. So you're going to give up 3 vials of blood, and that's going to tell us your kidney function, your sugar levels. We're going to know your blood count before surgery. And all of that is your baseline. It presents who you are before surgery. So that way, when we discharge you home, the goal is to have you back to baseline before we let you go. Chest x-ray is not for everybody. Chest x-ray is surgeon preference. They will determine whether or not they feel you need any kind of an x-ray done. It is usually something in the history that they're looking at. So not everybody can expect to have that. But medication review is for everybody. I need all of you, when you come to your pre-admission testing, to bring a sheet of paper with every one of your drugs wrote out on it. I need to know even vitamins, everything that you take by mouth, anything you put in your nose, eyes, or ears. That's all medicines that you use. We need a list of it. They're going to go over that list with you in detail and let you know what to take morning of surgery and what not to take morning of surgery. So just wanted to make sure that you all are aware that you need to bring that review, and we're going to later on, we're going to ask you to bring it back to the hospital. So stay healthy. It's a good time to say that, isn't it? Right now, while we're taping this, it's not flu season, hallelujah, but we are in COVID season right now. COVID is still with us, America, so we know that. So try your best to stay healthy. We want you to steer clear of all sick people. If you know somebody is sick, you're not being hateful by staying away. You're protecting yourself. Pretty much what you're having is an elective surgery. So more than likely, we would not cancel you if you came in sick. However, you're not going to want to get over a new hip or knee replacement and be battling diarrhea or head, chest cold, or something like that. It's just not going to be worth it to you. So I beg that you stay healthy. Let's say that you are a week away and you're starting to feel kind of this scratchy throat, ooh, don't feel quite right. Call your surgeon's office or call your primary doctor's office and talk with them and get something on board to try to get clear of the sickness before surgery. You will feel better if you come in as healthy as possible for your procedure. Night before surgery and everybody's packing, you're getting ready to come in here, okay? So remember I said I'm going to bring that medication list back up. I need you to bring it with you back to the hospital. Don't just write down what you take. Tell us how much. Is it 20 milligram or 40? Do you take it once a day or 3 times a day? And it's very important to be as accurate as possible because we want to make sure we have everything prepared for you when you come in. We want to make sure that we have a list of what you're current on so that we can give you your medicines here. The next 2 bulletins talk about loose clothing. And this is where I always say, do not pack skinny jeans up in here, okay? You all have a new wound, you're gonna be swollen and sore, and you don't want anything putting pressure on it. And then I have patients say, but what, I don't get that smoking hot gown to wear? Oh, yes, you do. You get it for one night. And it is wonderful. Breezy in the back, they're amazing. People love them. However, we don't want you to wear them the whole time you're here. So the next morning when the doctor rounds on you, they're going to ask you to go ahead and dress in your own clothes, something of comfort, because we're preparing you for the eventual trend to go home. Okay, so bring something comfortable that will fit over that wound, something that everybody that's coming in to see you will have access to look at the wound. Non-skid shoes with a back. There it is. LaDonna talked about this earlier. We don't like flip-flops. We don't want something without a back because we don't want you to fall. Basically, you will wear shoes twice in this hospital. You'll wear them coming through the door in, and you'll wear them going home. Other than that, while you're with us, you will sport these. They are amazing. They're the skid-proof socks, and you will not be alone. Everybody on FIP is wearing them, okay? Personal items, so your toothbrush, toothpaste, deodorant, things like that. Bring your own. They're yours. You like them, that's why you buy them. So we always ask that you bring your own things. That way you feel like home. It reminds you of home and it gets you geared up, ready to go back home. But let's say you get here and you're like, I forgot my deodorant, okay? We've got your back. We will have those supplies that we can hand out to you, but I promise you it will not be your favorite flavor or scent, okay? And then let's look at eyeglasses. I have quite a few patients that wear eyeglasses and they'll bring them with them to the hospital. Wonderful. We need you to be able to see, but we don't have the cases to protect them. So if you are bringing eyeglasses to the hospital, I ask that you bring some kind of protective case to keep them in because I don't want your items broke or damaged while you're here at the hospital with us. Hearing aid, okay? I have quite a few patients that wear the hearing aids. Some have the rechargeable ones and others have the battery operated. If you wear a battery operated pair, we do not carry the specific different battery sizes for those. So I ask that you would bring an extra pair of batteries for your hearing aids, and that way we do not ever lose communication with you while you're with us. CPAP machine. I have several patients that have a CPAP machine. If you are on one at home, please feel free to bring it in and use yours from home. It's yours, it fits you, it's the way you like it, it's got the settings set for you. But let's say you get here and you forgot to bring your CPAP machine. Lourdes has you back, we've got you covered, okay? So I will promise you though, it may not fit exactly the way you're used to. And so just want you to be prepared that that it may not be to your liking. If you like your CPAP with the humidity in it, the water in it, you can bring it dry, and we have the distilled water to put in it for you. Okay. Do's night before surgery. All right, so the first bulletin there says take the medication that pre-admission told you to take night before. All right, so you are going to take that medicine morning of surgery with the tiniest little sip of water you can choke the medicine down with, okay? Because we do not want a whole lot of stuff on your belly morning of, okay? Now let's go down to Hibiclens. That is a special soap that we want you to use prior to surgery. For my Dr. DeWeese patients, I know that he gives you a paper from his office that states he would like you to use that soap 5 times on your extremity prior to surgery. And that is fine and wonderful. We recommend that. That's fine. Use it 5 times on your extremity. However, I need for every single patient, hip or knee, any doctor, to do 3 in a row showers with the Hibiclens soap. Neck down showers with that soap. So that would mean like if you are a Tuesday surgery, you're going to do a Sunday night shower. You're going to do a Monday night shower. And yes, you are going to get up Tuesday morning and do your last, third, final shower with that soap. So the soap has specific instructions. It says to get in the shower and lather up. Okay, the soap, folks, does not lather, just a heads up. But you attempt to lather it up and slick up with the soap, neck down. Get out of the water and time yourself for 2 full minutes. Get back in the shower water, rinse off, 1 shower, done. You've completed 1 shower. You have 3 of those to do, okay? Let's skip over to the Bactroban. Bactroban is an ointment. We will provide you with the Hibiclens soap at pre-admission testing. They're going to give you a little bag that has the soap and instructions in it. Bactroban, we cannot supply that. That takes you have to have a prescription for it. Couldn't spit that word out. Prescription. So the office should have called you a prescription into your pharmacy. Go pick it up. We like it to be used a week before surgery, twice a day in each nostril. You're going to rotate that Bactroban up in your nose. So that is very important to use because MRSA lives and hibernates and colonizes in our nose, and we're killing that out before surgery. Okay, so now the next line talks about patting dry with a clean towel. That is after each one of those showers with the special Hibiclens soap. I want you to get out, dry off with a clean towel. Don't you use the same towel you've been drying off with all week, okay? I need you to put on newly laundered pajamas after your shower. Don't wear the same boxers you've had on all week. And the most important, night before surgery, change your bed linens as well. So that way everything is nice and clean, and then you wake up the next morning, and what do? You get your 3rd and final shower before coming to the hospital. So we've done the do's. Now let's go to the don't list. There's always got to be a don't list, okay? Do not, after you get out of these showers, do not apply lotions and powders all over you because you have just recontaminated your body, okay? The only thing that I will tell you you are allowed to use is deodorant. Surgery staff will thank you. So put your deodorant on, okay? No shaving 2 days prior to surgery. You say, for the men, they're like, I can't shave my face. Yes, men, you can shave your face. Women, yes, you can shave your armpits, okay? What we're talking about is our leg, the extremity that's going to be worked on. And the reason for that is because we don't want an open wound, nick, or cut on the extremity that's going to have surgery. So be confident and know that surgery is aware. I'm asking you not to shave, okay? 2 days prior. Do not eat or drink anything after time instructed. This is important because none of you know exactly what time you're coming for surgery. Some of you have surgeons that do 3, 4, 5 totals a day, or 3, 4, 5 surgeries a day here. And so you may not be first on the list, okay? So what they're gonna do is call you night before surgery. If you're on Monday surgery, they will call you Friday before and let you know what time to be here. Any other day of the week, you will be called the night before. So when they say don't drink or eat anything after time instructed, find out what time you gotta be here. If you have to be here not until 2 or 3 in the afternoon, ask them, what time is the last time I can have something to drink or eat? Because you'll be starving if you have to wait from midnight on, trust me. Please don't bring anything of value, great value here. I always tease and say the 2-carat ring needs to stay home, okay? If you forget and bring something of great value here, I ask that you have a friend that's gonna take care of it for you. As far as valuables go, we talk about, we'll hit on money. I usually say you don't need any money. I mean, we're providing your meals and things like that, but we have a wonderful new program here. It's called Meds to Beds, and pretty much they can cover almost any insurance now. And so if you want your medicines filled here at our hospital prior to going home, then you do have to pay for them before you leave, just like you would pay for them at a pharmacy. So if you think that's going to be an option, bring either some cash, but they will take credit or debit cards as well. So think about at least maybe bringing that in order to pay for your meds before you go home. And then the last line says, do not bring your own medications. We will supply those for you. Unless you are on something odd or unique, maybe it's a Parkinson med or some kind of medication you take that you think, oh, they might not have that particular medication for me. If you are worried about it, bring it, but please remember to bring any med from home in its original container. It should have the prescription on it that tells how you take it, and then we will take that, hand it over to our pharmacy here. They'll relabel it, let you use it, and then you get it back before you leave us, okay? Day of surgery, woohoo, you made it. You're gonna come in. Everybody needs to come in down at the end with the Marshall Niemer entrance with the big ball statue. That's where I tell everybody to come. You will come in past that big ball and go to the left in that little waiting area right there and let them know you're here for surgery, and they will direct you down to the surgical department where you need to be. No jewelry. I need all belly button rings off before you come in here, okay? We don't want jewelry on you because they use a cautery during surgery that doesn't need metal to be on you because it could arc. So if for any reason you've got something on you that we can't get off, maybe a ring that's been on your finger so long it's stuck, let your nurse know and they will put a piece of tape around it to keep you protected for the surgery. No nail polish, sorry. But women, you can paint your toes, okay? And I always say paint them glitzy and glingy. We want something really blinging, and surgery staff gets a kick out of that. So paint all the toes you want, but no nail polish, okay? Hospital gown, there it is, as promised. You'll get to wear it the first night, so enjoy. IV, ooh, and I made an error. I need to get that number 2 off there. IV is now 1 per patient, hallelujah. So 1 IV, and they'll usually put it in either arm, okay? Antibiotic to prevent infection. Every single one of you will be started on an antibiotic about 30 minutes to an hour before incision's made. And all of you while you're here at the hospital will remain on an antibiotic. Every so many hours, they're gonna come in the room and rehook to your line, run some more antibiotic through you, and occasionally, some of you may even go home on an oral antibiotic. Consent will be signed. This is a time of seriousness, okay? Make sure everybody you speak with knows that you're having your right knee done, okay? And the most important part to me is that you will meet with your surgeon right before you roll back to surgery. That is awesome, because any last minute questions you might have, you can discuss with him at that time. And the most important part is he has to put his signature on your leg, or you do not get to roll back. So that's comfort, I would think. All right, let's talk anesthesia. Oh boy, spinal versus general, okay? Most all total joint replacements now are being done under a spinal. Please do not panic. This is a very great way to have surgery. The spinal lasts about 4 hours. So most of that you are in surgery, in recovery, and by the time you get to 5th floor, it's all starting to wear off and everybody's tingling, okay? So the spinal is a one-shot deal in the back. And so they will put the needle in, push the medicine through, pull the needle out, and then when they lie you down, you do not lie down on any kind of needles whatsoever. And like I said, it will generally last about 4 hours. All right, spinals are, how do I say, you are not a pin cushion, okay? So the spinals are being done by these anesthesiologists and the anesthesia providers. They're used to doing them. They've been doing them for about 3 going on 4 years now. They are really excellent at it. And so they're going to do a poke. And if they can't get the spot the first time, they may move the needle and do a second poke. But after that, if they can't get it for whatever reason, they're not going to keep poking, okay? So don't panic. They're going to eventually just get to a point where they're going to go ahead and put you off to sleep. So general is total sleep. You don't know anything, you are totally unaware, and the most important part of a general is that you cannot breathe on your own. So a tube is placed to help you breathe. And so if you have to be a general, when you wake up, you might have a little scratchiness. Not a problem. We will order you whatever it takes to clear that, be it a spray or some lozenges. Now let's go back and say you are a spinal. You still get to sleep. It's like colonoscopy sleep. You don't know anything. You are totally unaware. And it's just wonderful, because once that all wears off and you wake up, my patients they feel good, and there's not a lot of the sickness and throwing up and nausea that goes along with surgery. Now let's talk block. Block is not for any procedure except for knees. Okay, so hips, I'm sorry, there's nowhere to inject you to give you a block on just the hip. But knees, they can give you an injection at the top of your leg, and it will provide much comfort for the back part of your knee post-surgery. Usually the blocks will last anywhere from 8 to 14 hours, so you've got a good coverage on that leg, and it provides for a lot of comfort right after surgery. Local in the joint is for everybody. Hip, knee, does not matter. So what it is you're already open on the table. The surgeon can see all around that joint area, and he injects the tissue all around that area, and that does provide a great comfort for right after surgery. Post-op day 0. All right, as promised, all of you wind up on the 5th floor, okay? And everybody will have a private room. So you are welcome to bring one family member with you. That family member, if they so choose, can spend the night with you. We don't care. We welcome that. Vital signs. I'm sorry to say they are going to be hitting you very hard with vital signs for the first few hours. They're going to be checking to make sure your blood pressure is coming back, heart rate, everything is stabilizing, and that's what we're looking for. Bandage. All right, this bandage is generally for my hip replacement surgeries. And when you wake up after surgery, it will be plastered on the front of your hip. And you will see this bandage. For most of my patients, this bandage is not removed until post-op day 2. Knee patients, unfortunately, the bandage looks much longer. It doesn't mean your incision is this long, okay? But it is slightly longer. It goes over the knee, and then an ACE wrap covers the rest of it. So you will not see this bandage until the next morning. In the next morning, they're going to take the ACE wrap off, peel this off of you, and you, knee patients, will be open to the air after that. All right, foot pumps right here. First line of defense against a blood clot. So while you are in our hospital lying in one of our beds, I want these on your feet working. It's going to squeeze a foot and release. Squeeze a foot and release, and it'll go back and forth and back and forth. And so think of this as a foot massage, and you'll love it. Of course, when you get up to walk, to move, or to get into the chair, we will remove these, but anytime you're lying in bed with us, I want these on your feet and working to help you. Incentive spirometer, this little jewel right here. Okay, this is, everybody will get one of these. Before you leave the hospital, I expect you to take it home with you. If you are blessed and have somebody like LaDonna come into your house, she's going to ask you where it is. So make sure you have it at home. This is your first line of defense against pneumonia. Pneumonia is a legitimate thing that can happen after surgery, and we don't want that for you. So you will take this home. This is not something you blow in, you breathe. So you don't, you breathe in, nice and slow and easy. And it has little etched faces on it. At the bottom is a frowny face. At the very top is a frowny face. Right in the middle is your little smiley face. So when you breathe in, you want the ball to come and hover here, while this side slowly makes its way up to the blue mark. So take this home with you. I expect you to use it every single hour through the day that you're awake, okay? Ice to your wound. Does not matter if you are a hip or a knee, you're going to have swelling and pain. So ice will be your best friend for a while. So if you are a hip, you will have these little ice bags. They're disposable that we will give to you to use. We'll give you several to take home with you. Keep the ice coming. That's going to help that wound heal and make the pain better. Knees, you guys undergo a lot more swelling overall than the hip, and it seems like it just takes a little longer to overcome knee surgery. So you guys go home with an ice pack that goes around your knee, and you have a little cooler that goes with it, and you will take that home as well. That's going to be something you're going to need to use for at least the first 1 to 3 weeks after surgery, okay? IV fluids. Remember, this is the same day you had surgery, just later in the day. So this whole day and night, you will be connected to a pole. They're going to have fluids hanging on a pole. So anywhere you go, the pole goes with you. By the next morning, hopefully everything looks good on lab work and we can disconnect you from the tubing. Catheter. This is for my Patel patients. Dr. Patel uses a catheter for the bladder, and that is for hips and knees, period. Dr. DeWeese does not use a catheter. Beck does not use a catheter. And Dr. Kern only does if anesthesia requests one. So there you know. Therapy. This is not home therapy. This is hospital therapy. So hopefully they're going to come see you the same day you had surgery. Basically, it'll be a minimal appointment. It's going to be come in, see if you can stand up at the bedside, maybe sit down in a chair beside the bed, or if you don't have a catheter and need to use the restroom, maybe they'll help you get to the bathroom. Now we're going to talk pain management. Pain management, folks, it is not an art. Well, it is an art, it's not a science, okay? There's no concrete how to deal with pain for each individual. Every person deals with pain differently. And so we just need to know your reality, where you're at with your pain. There's going to be some scheduled pain medicines that show up at your door. You will not have to ask for it. It comes in a timely fashion. Things like Tramadol, Tylenol, ibuprofen, and or an extended release, maybe Oxycontin or MS Cotton. So those things show up. You don't have to request them. They just come. Notice the have to ask for as needed pain medicine. That's the medicine that acts quickly. It's usually a medicine that lasts about 4 hours. All of you have that medicine ordered. You will never get that medicine unless you ask for it. Tell them you need your pain medicine, and you can have it every 4, but you have to ask for it to get it. So I want you to be aware of that, because I want to make sure the pain medicine actually works for you. Is it holding you good for the 4-hour mark? And then the key is it really holding you comfortable at rest? That's the key, because it does not matter how much pain medicine you give a person. When they go to stand up and actually walk on their new joint, they're going to know they've had surgery. We cannot get rid of all pain 100%. However, we want you as comfortable can be at rest. And the good thing is that for the most part, doctors want you resting and relaxing, getting this pain, getting the swelling out, and getting the joint, letting it heal. So that's the goal, is to make that medicine work for you. We need to know it works for you, because that's the script. That's the medicine you'll go home with. So make sure you're very honest with us about how it's working, and is it holding you 4 hours at a time. Honeymoon phase. You see that line right there? That is the initial, when you come to the floor, everybody's happy. They're all like, this is great. And you're showing me moves with your leg you haven't done maybe in years. Okay, folks, you're going through what we call the honeymoon phase, and it does go bye-bye. So be prepared. Know that, yes, that's an insight for you as to what the future holds, because that does feel great. That honeymoon phase does, and eventually you are going to get there on your own down the road, but it's just a little pre-taste of things to come. Pain scale of 1 to 10. 1, least amount of pain ever. 10, cussing, throwing stuff, you're mad at the world, it hurts. Okay, I don't want you to be a 10. I really don't. So the goal is to keep you somewhere down around the 2, 3, 4 mark. Okay, I don't like a lot of people to be at 1, because generally 1s don't want to breathe because they're so comfortable. We're going, breathe, gotta breathe. Okay, so realistically, we want you to be honest with us where your pain's at, because where you're at is how we're going to dose your medicine. Okay, we're not going to give somebody that doesn't have much pain the maximum dose of medicine, and vice versa. We don't want somebody writhing in the bed getting the smallest amount ever. So tell us honestly, and hopefully we can just adjust accordingly. Do not be brave. The medicine's there. It's been ordered for you. Use it. Treat the pain so you can function. So that means that you can walk with therapy. When they come in the room, that you can get up and do what therapy is requiring you to do with them. And then taking pills to determine the best choice for you. The reason we say that is because every one of you have IV pain medicine that they can shoot through the IV that brings about a comfort pretty quick. Most of it lasts about an hour and then it's gone, just that fast. So we can do that, but we're not going to live on that, because that nobody goes home with an IV in their arm. So that is not going to be an option for you. So we need to know that you're taking the pills every 4 hours and they're holding your pain at a comfortable level at rest. Therapy, baby steps. Stand at the bedside, walk to the bathroom, get up in a chair. That's probably 1 session. Maybe you make it to the doorway by the 2nd session and look out in the hall. In the 3rd one, most of them are getting up and getting in the hall and walking. Wonderful. Here's the thing. I don't want anybody up there walking circles in the hall. The more you're up on it, the more swollen it's going to be, the more pain you're going to endure. So what I want is for each one of you that gets up to walk in the hall, walk in your mind the distance that it would take you to get from maybe the car into your house safely, or maybe from a back bedroom up into the living room or kitchen safely. That's the kind of distance we're looking for. Are you going to be safe at home when we discharge you out? Goal is always safety first, And then functional mobility. We want to make sure that you're actually using your new joint proper. Every single one of you will walk with a walker, period. In the hospital and at home for the first few weeks, you will all walk with a walker. Post-op day 1. All right, so this is, you were Tuesday surgery, this is Wednesday. Hopefully your labs look fantastic, your blood pressure is great, and we're going to cap off your fluids. You will still have an IV access port left in the arm, but we will not utilize it except for antibiotics and things like that. Take out the catheter. If you are a female Patel patient, your catheter will be removed that day at 5 o'clock in the morning. If you are a male patient of Dr. Patel's, the catheter comes out upon full filling returned to your legs and feet and things like that. You will be asked to dress in your own pajamas or clothes. This is gearing you up, like I said, to go home. That's the goal, to make you good enough, to get you stable enough to go home and finish your recovery. Therapy, this is physical therapy is going to be coming to see each one of you twice in this day. So 2 times a day is their general rule. Usually it's before lunch and after, 1 in the morning, 1 in the afternoon. And the therapy, like I said, is just to get you moving, hopefully moving enough distance to make you safe at home. And then we're going to be working on pain management. Hopefully by day 1, we are doing nothing but peels. We're beyond the IV, and we are icing you all down because you're super hot. All right, criteria to go home. Here it is. This is what you have to meet in order to depart from the hospital. You have to show us that you can safely get up in the room. Basically, I need to know that you can actually get out of the bed and manage to stand up safely and hang on to the walker and navigate maybe to the bathroom. Okay, so simple, just simple movement. Pain has to be controlled. If you are getting an IV pain shot every 3 hours, you cannot go home. We have to know that the pills are doing it for you and that they are holding you good for the 4 hours at a time. Eating. Hospital food, folks. And I say that teasingly now because literally the food is pretty delicious now. We've got a wonderful chef and he or she does a great job and the food is remarkable. So what I mean by eating is you do not have to clean your whole plate. We do need to see that you can take food in and that it stays down, okay? Last of all is bathroom, okay? I told you that pretty much earlier, I told you that you will go home from this hospital, you will not have had a bowel movement. So that's not what we're talking about, okay? This is actually what I call peeing, okay? Voiding. If you cannot pee after one of these surgeries, that is a true emergency and we cannot let you go home. We have to know that the bladder works and that not only are you peeing, but you're actually emptying the bladder. So not to be disgusting or gross, but we are going to bring containers in your room to capture the pee. For women, it's usually called a hat, and we tuck it in the commode, and that's what you will use. That way we can measure and make sure you really are getting that bladder empty. For men, a urinal. So please don't flush it, don't get rid of it. We need to eyeball it, measure it, see it, to know that you are literally peeing like you're supposed to be. Anybody going home in that? Hope not. Okay. In all seriousness, think about what you're going to ride home in. We really probably would not want a Corvette as an option either because that's too low. Okay. So think about it. For hips, as a general rule, hips, you're going to have to use your hip. Anytime you go to sit or get up, you're actually using your hip. Okay. Knees, however, a little different story. Most of my knees do not go home bending their knee. Okay. Most of the knees want to try to keep it as straight as possible to get in a vehicle. So if you notice, straight as possible means you got to have a lot of leg room, okay? So have something that's not real low to the ground, something that's easy to get into, and something that gives you plenty of leg room to move around, okay? All right, I'm going to turn it back over to Miss LaDonna for a few.
We're skating right along.
Yeah.
All right. So, total knee replacements, whether you're going to do home care physical therapy or you're doing outpatient physical therapy, it's generally 3 times a week for 3 weeks. Every now and then, somebody needs a little bit of extra physical therapy. Don't worry, the docs are okay with that. If you need more than 3 weeks in your total knee replacement, no big deal. We'll get it taken care of, and we'll get it added on too. But I will tell you that a very high percentage only need 3 times a week for 3 weeks. Hip replacements, 2 times a week for 2 weeks. Guys, you're not getting shorted here. You just don't need us that much. The docs wanted you guys that are doing home care to be at home, to be resting and relaxing, and that's part of the reason that they do the home care, because we've got to slow you down a little bit so you're not moving too quick and set yourself back. Hip replacements, we're going to do functional mobility with you. Knee replacements, we're going to do functional mobility with you. But something for you to know, that if you're a Dr. Patel hip replacement, you will only get the functional mobility. You won't be doing the therapeutic exercises because that's his protocol. The docs have different protocols. The good thing is they all work. It's just their different style of how they treat their patients. So if all the doctors are doing home care for hip replacements right now, am I correct?
But all are doing home care?
Yeah, for hip replacement.
Beck does not.
Okay, so
Yeah.
Dr. Beck, if you're a Dr. Beck total hip replacement, you may end up doing outpatient physical therapy. If you're a knee replacement and you're Dr. Patel's patient, and you'll end up getting home care, that's his protocol. If you are a Dr. DeWeese total knee replacement, you're generally going to go to outpatient PT. If you're a Dr. Kern total knee replacement, it could be either or. He decides with each patient. So these are the counties on this slide that Lourdes Mercy Health works in. We work in Johnson, Pope, Massac, Livingston, McCracken, Ballard, Carlisle, Graves, and Marshall. So if you live in any one of these counties, of course, we'd love for you to choose us so we can come out and see you for your physical therapy and your nursing needs. If you have home care, if that's what your doctor is going to write the orders for, if you're one of our patients, you for sure have a 24/7 nurse line. So you might be at home, but you're not on your own. And I can't say for certain that if you live outside the region that we work in and you're going to use a different home care, that they have that 24/7 nurse line, but I bet that they do. All right, you want to go on to the, all right. So we're going to talk about swelling. All of you are going to have swelling, whether you're a hip replacement or a knee replacement. So both of you listen here. But I'm going to talk about the knees a little bit first. If you're a total knee replacement, your doctor, no matter what their protocol is on other things, they want you to rest and relax with your knee straight. They really don't want your feet on the floor that much for the first few weeks. If you're getting up to go to the bathroom, sitting on the toilet with your feet on the floor, you're sitting at the table with your feet on the floor having a meal, no big deal, that's fine. But if you're resting and relaxing, you're in your nest, then he wants your legs straight like this. So the wonderful thing about that is it's going to help you get your extension back, which can often be the hardest thing after a knee replacement. But if you're right here, you're not going to gain fluid. It's not going to just steadily go down and get worse, but it's also not going to back out, and it's not going to get less. It's going to stay status quo. So if you will do a little elevating, get your ankle above your knee and your knee above your hip, just at a very gentle angle, just very slight. It'll back that fluid out and you will feel better faster. And generally what you can do, even if you're in your recliner, you may still need the pillows. Do a couple of bed pillows, long ways like this. You cannot pillow this way unless you're doing the exercise with your black pillow. So if you do a couple of bed pillows with the knee well supported, you've got to get it comfortable to be able to sustain the position. So if you get the pillow up here and get 2 of them up here, don't get a hitch in it where the knee's bent. You may have to adjust from time to time, but get it about like this and back that swelling out, and you'll feel better faster and your range of motion will come on. So hips, I said stay tuned. I wanted you to listen to that as well. I want both of you to start your night in that position. You do not have to live in this position at night. After a couple of hours, you're going to get up because inevitably that swelling is going to leave you, which means you're going to have to get up and go to the bathroom. It is a good thing. So a couple of hours after you go to bed at night, if you want to get back in bed after you went to the bathroom and change positions, you've gotten to where you can get that pillow in between your knees and get comfortable on your side, you're not going to hurt your hip or your knee. It's just not going to be comfortable for you at first, so most of you are going to be on your back for a little while, even though that's probably not your preferred position. I want you to get in that position for the first few hours at night and get that leg up, keep that swelling out. And the reason I say hips, even though you don't have as much swelling as the knees, is because I've been doing this for a long time, and hips across the board tell me that if they elevate at night, get both legs or at least the surgical side up, they sleep better. So hips, try it too. Knees, do it more for the swelling. And you guys make sure you're using your ice packs. If you ice and elevate, you'll get your swelling out. You'll feel better faster. All right. It's Kathy's turn again.
Thank you. So deep breathing. Want to make sure all of you take this home. Use it, use it, use it. I will remind you with a little log that I'm going to send home with each one of you that says every hour need 5 good breaths with that. Ankle pumps. Remember the pushing and the pulling, push, pull, push, pull. We want you to continue to do the ankle pumps because that is going to promote circulation in the legs and it's going to help prevent blood clots. Incision check. You're going to be looking at it every day. It is, all of you will go home open to the air, all bandages come off. You're left exposed. Every one of you will be stitched shut. So the stitching does not have to be removed. The stitching reabsorbs into the body and goes away on its own. So the dressing that each one of you will have on is a little thin piece of tape and some glue. LaDonna likes to refer to the tape as modified carpet tape because that's what it looks like.
It really does.
It does. So it'll cover your incision and you'll be glued shut. So all of you will be open to the air. That glued dressing is a waterproof dressing. You can shower with that dressing on post-op day 2. And from then on, you're allowed to shower and you won't hurt anything on the wound. Walk in for calls of nature. So we want you to get up for everything necessary. Bathroom, a bite to eat, something to drink. And I always say when therapy's ready to work with you, that is a call of nature. You must get up and do those things. So that's what we want you to get up for. Walking several times a day, short distances, the bathroom breaks alone will probably cover most of that. And focus on healing, everybody. Treat this like an injury. Once it is healed, you will be so much happier and feel better. Follow-ups. All right. Dr. Kern and Dr. Beck. You will see your doctor 2 weeks from surgery. Okay, so both of those doctors try to have you in 2 weeks after surgery. Dr. DeWeese, you will see him at 4 weeks after surgery, and Dr. Patel 6 weeks after surgery. All of you will have your appointment in your paperwork before you leave the hospital. That way you'll know exactly when you're to follow up. Driving, okay. Pretty much across the board, it needs to be about 4 weeks before you attempt to drive. It just takes that long to really get the mind to clear after surgery. The most important thing to remember is before anybody drives, you have to be off the walker. It has to be put away in the closet somewhere, and you cannot pop a pain pill and get behind the wheel. That's a DUI. So those 2 things have to be met first, but as a general rule, 4 weeks is your safest time to start getting behind the wheel again. All of you will walk with a walker until therapy graduates you. Your spouse cannot get you off. You cannot get you off early. And it takes a therapy to say enough's enough with a walker. Why them? Because they are watching you actually use your new joint and making sure you're walking proper. Some of you are limping and have been for a while, And it's going to take a little bit to learn and relearn how to walk proper and use your leg like you're supposed to be using it. So therapists are watching. They do not want you on the walker any longer than you have to be. Knees sometimes need a little more therapy. 3 weeks is, as a general rule, perfect. But every now and then somebody needs that extra week or two. It's rare, but it can happen. Don't feel like a failure. If that is you, therapy has already recognized that you need the additional therapy. They've already arranged it with your surgeon. You just keep showing up and showing out. That's all I say. Swelling can occur again. Your body is under an inflammatory response post-surgery. Literature, as well as the surgeons, will tell you that can happen off and on up to 2 years. Does that mean you're going to be this swollen after surgery for 2 full years? No. No, what it means is you can be 6 months out, you're feeling great, life is good, it's a beautiful day, and you're playing 18 holes at the golf course, or you're fishing in a boat and standing up all day catching them fish. Maybe you've walked the entire mall and blown your wad of money, okay? Whatever it is, you've been on your joint a long time and you notice that some swelling is occurring. You have not done damage, okay? It's just your leg telling you, please get off of me for a little while, rest me, elevate me, ice me back down, and I promise I will go down much quicker than I did right after surgery. Complications. 3 majors that we cover: pneumonia, blood clots, infection. Those 3 are very significant and can be life-changing complications. So let's talk through them. Pneumonia. The doctors have all given you antibiotic while you've been at the hospital and kept you on antibiotic periodically while here in order to protect you and prevent pneumonia. Your role is to deep breathe. So that's your job. Take that home, deep breathe every hour awake, and that will help protect your lungs. Blood clots. The doctors have all put you on a blood thinner to protect you from developing a blood clot. That is their role. What's yours? Yours is the ankle pumps. Ankle pumps. Do them. I can't tell you to do them enough. At least 10 ankle pumps every single hour awake through the day. That is going to help promote that circulation and keep the blood clots away. Wound infection, this is it. This is your number 1 defense. Wash them, okay? Anybody going to touch your wound, ask them to wash their hands. Have you washed your hands? Make sure you see them clean their hands. Basically, some of you have grandkids. Grandkids are adorable till they pick their nose. Don't let a grandkid pick their nose and touch your wound, okay? Your fur babies, oh, they're so sweet. Don't you let them come up there and scratch or claw one of your new wounds, okay? So that's the main thing. And the dressing check, basically, you're just keeping an eye on that incision, making sure nothing's oozing, draining, seeping, or leaking out. The last line there talks about checking with your surgeon before a dentist appointment. Teeth are disgusting. Nasty bacteria lives in the mouth, okay? So it is very important that before you go to any kind of a dentist appointment, you have an antibiotic to protect you from any form of infection. Antibiotics are not the antibiotic of old where you took a whole week's supply. We're talking a one-time dose, usually 1 to 4 pills. You will take it 30 minutes to an hour before your first dental appointment and you're done. You have covered your new joint from infection. Pretty much literature will tell you that you need to have that antibiotic on board for up to 2 years. You need to protect yourself every time you go to the dentist, even for teeth cleaning. I will tell you, if it were my total joint, I'm going to protect it for the rest of my life, okay? So if you have any issues with getting an antibiotic, your surgeon will write you for that antibiotic. Most dentist office will write you for the antibiotic. So talk to them and they will make sure you are covered. Basically, the bacteria in the mouth will go to 2 places in the body. It will infect a heart valve, or it will go to a total joint replacement. So keep that in mind. Call the doctor if. Wound drainage, big deal. Anything oozing, seeping, leaking, draining out of that wound is a no-no. Do not play doctor. You call, because that somebody needs to know about that, and that needs to be addressed by your surgeon. So that is something you would definitely call for and watch for. Fever with chills. Okay, this may shock a lot of you, but your surgeons have told me time and again that unless the fever is 103, you're not sick yet. Okay, so 103 fever, you need to seek help. You don't have to call anybody, just go. Somebody needs to put eyes on you to make sure something's not going awry. 102.9 or less, all these surgeons will tell me they are not sick yet, so I'm going to tell you what to do. 2 Tylenol for fever. You pick up this incentive spirometer. Remember, you took it home. So pick it up, take 10 big, slow, deep breaths. You won't feel like it, you're fevered. Sit up and take the breaths. Cough, 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 cleanse your lungs out. Give yourself about an hour and a half time. Recheck your temp. Promise you it should be coming on back down. Okay? Last of all is calf pain. Generally speaking, we're talking knees down, either leg. Okay, lower leg. And what it is it begins by swelling. You'll notice significant swelling. We're talking more than double the size of the leg, sometimes triple, quadruple the size of the leg. It gets significant. The swelling doesn't stop, therefore there is horrendous pain that goes along with it. Generally, the pain is in the upper calf muscle or behind the knee. A dead ringer for me is that you cannot ankle pump at all. On a leg with a blood clot, you are unable to force that foot down or pull it back. Left undiagnosed, discoloration in the leg starts happening, and eventually a very cold foot develops. That's significant. We need to hear from you. We can correct a blood clot, but we can't if we haven't heard from you and know to do it. We can get you in to get an ultrasound check. You can have that done locally wherever you live. Some of the doctor's offices can provide that, but we need to know about it to help you. You will have phone numbers when you discharge home. You all will have the doctor's office phone number. You will have home health phone number, 24/7 line, if you are privileged to have the home health. And all of you will be given my cell phone number. I used to say 24/7, not so anymore. Jesus first, people, for me. So I do not pack a phone to church. What I'm trying to tell you is, if you call me during church hours, I'll see I missed a call from you and I'm calling you back as soon as I get back out to my car. I also shower and mow, and I don't always hear it. So leave me a message. I'll be glad to reach back out to you, okay, as soon as I see I've missed a call. If you have questions, you have the number there on the screen. That is my office number. It is a confidential voicemail. You feel free to leave me a message. I'll be glad to reach back out to you business hours. But all of you, like I said, will have my cell phone upon discharge, and that one you can reach pretty much 24/7, okay? Thank you so much. I hope you've learned something from Joint Camp that will help you and encourage you that this surgery is, you can do this.